Does the time of day you move your body make a difference to your health? Undertaking the majority of daily physical activity in the evening is linked to the greatest health benefits for people living with obesity, according to researchers from the University of Sydney, Australia, who followed the trajectory of 30,000 people over almost 8 years. Using wearable device data to categorize participants' physical activity by morning, afternoon, or evening, the researchers uncovered that those who did the majority of their aerobic moderate to vigorous physical activity, the kind that raises our heart rate and gets us out of breath, between 6 p.m. and midnight had the lowest risk of premature death and death from cardiovascular disease. The frequency with which people undertook moderate to vigorous physical activity, MVPA, in the evening, measured in short bouts up to or exceeding 3 minutes, also appeared to be more important than their total amount of physical activity daily. The study, led by researchers from the university's Charles Perkins Center, is published in the journal Diabetes Care Today. Due to a number of complex societal factors, around 2 in 3 Australians have excess weight or obesity, which puts them at a much greater risk of major cardiovascular conditions such as heart attacks and stroke, and premature death, said Dr. Angelo Sabag, lecturer in exercise physiology at the University of Sydney. Exercise is by no means the only solution to the obesity crisis, but this research does suggest that people who can plan their activity into certain times of the day may best offset some of these health risks. Smaller clinical trials have shown similar results. However, the large scale of participant data in this study, the use of objective measures of physical activity in hard outcomes, such as premature death, makes these findings significant. Joint first author Dr. Matthew Amati also stressed that the study did not just track structured exercise. Rather, researchers focused on tracking continuous aerobic MVPA in bouts of 3 minutes or more, as previous research shows a strong association between this type of activity, glucose control, and lowered cardiovascular disease risk compared with shorter, non-aerobic bouts. We didn't discriminate on the kind of activity we tracked. It could be anything from power walking to climbing the stairs, but could also include structured exercise such as running, occupational labor, or even vigorously cleaning the house, said Dr. Amati, National Heart Foundation postdoctoral research fellow at the Charles Perkins Center, University of Sydney. While observational, the findings of the study support the author's original hypothesis, which is the idea, based on previous research, that people living with diabetes or obesity, who are already glucose intolerant in the late evening, may be able to offset some of that intolerance and associated complications by doing physical activity in the evening.